Welcome to the Palm Beach Civic Association's Committees at Work. In this series of reports, we present a three-part program on dementia and Alzheimer's disease, brought to you by the Civic Association's Healthcare Committee. Join us as we delve into the complexities of these conditions, exploring the latest research, innovative treatments, and compassionate care strategies. Today, we begin with Understanding Dementia, the first of 3 episodes in this series. The cost of Alzheimer's and other dementias to the U.S. economy is estimated at $355 billion in healthcare, long-term care, and hospice. But the greatest cost is immeasurable: the emotional cost to the individual, family, and friends. We begin at the Comprehensive Center for Brain Health at the University of Miami Miller School of Medicine in Boca Raton, where Dr. James Galvin and his team are working to better understand the aging brain and design treatments and prevention plans that will result in longer, better lives. Dr. Galvin, thank you so much for joining us today.
Thank you for having me.
Tell us about your work in particular and what you're doing right here at the Comprehensive Center for Brain Health.
So our group is a transdisciplinary group. So this means we have a number of investigators from many different specialties coming together to try to understand what it means to have a healthy brain as we age, and why do some people develop problems with their memory and thinking, like Alzheimer's disease.
Geraldine Reese is helping doctors here at the Comprehensive Center find answers. She's a longtime participant in a study called the Healthy Brain Initiative, an ongoing dementia screening.
The study here, they put you through a few tests to find out what your memory is like.
Geraldine, a published author, is not showing signs of dementia, but does have a family history of neurodegenerative disease.
My mom developed Alzheimer's and my older sister has Alzheimer's now.
Are you concerned that you might develop it?
Oh, yes.
The Healthy Brain Initiative is an ongoing, multicultural, federally funded dementia screening for adults with no complaints or mild concerns about their brain health.
With my family having a history of it, I have no choice but to do what I can do to try to get others to participate in it as well.
Dementia simply means a change in memory or other thinking abilities that interferes with someone's ability to do their everyday activities. So dementia is not really a disease, it's really a syndrome. It's a collection of symptoms that tells us a person is different from the way they used to be. The most important thing is, if there's signs of a dementia, then what is the cause of that dementia?
You sometimes hear the words dementia and Alzheimer's used interchangeably. Tell us the difference.
Dementia is the general term, means a change in memory. Alzheimer's is the most common cause of dementia. All Alzheimer's is dementia, but not all dementia is Alzheimer's. So if you want to use an analogy, you can think of the word car. So the general word car, a 4-wheeled vehicle that gets people from point A to point B, but there are lots and lots of different types of cars. So dementia is the general term for a change in memory and thinking abilities. Alzheimer's is the most common cause of dementia, but there are over 150 other causes of dementia.
Typically, when we think about dementia and Alzheimer's and cognitive loss, we're thinking of elderly populations. But tell us about what you also see in patients who are 60 or younger.
It's an equal opportunity exploiter, right? So everybody potentially can develop it. Most commonly, it begins in late life. So most commonly, it begins in people over the age of 65, and even more so over the age of 80. But it can occur early. There are early onset cases that have been described as early as in the early 30s. So that's rare, but it can occur. Most people will develop disease after age 65. So at age 65, it's about a 2% risk of developing disease. By age 85, it's about a 40% chance of developing disease.
What is probably the most common question you get when someone comes in here? Are they in denial, or do they recognize that they may be experiencing memory loss?
Some people are aware that things are changing, but some patients are less aware. Often the way people show up in the office is that not so much that the patient has noticed changes, but that someone who knows them well has noticed. So their spouse, their adult child has recognized that mom or dad or my husband or my wife is somehow different now than they used to be, and that often triggers the evaluation.
And tell us about that evaluation. What are the steps that people go through?
So on the clinical evaluation, the most important thing is to get a good history and physical exam. So we want to talk to the patient to get the patient's perspective, but whenever possible, we'd like to independently speak with another source of information. So the spouse, the adult child, grandchild, a close friend, right, who can tell us independently if that person has changed. And we want to ask questions about their memory functioning, their orientation, their ability to solve problems, what they're doing, outside the home, what they're doing inside the home, their personality, their behavior, so that we can get a good sense of what the person used to be like and what's happening now. Because the key feature, again, is change. Has a person changed from the way they used to be?
You walk into a room and you don't remember why you're there or what you were in there looking for. I think that's happened to a lot of us. What does that mean? Does that mean that somebody necessarily has early onset dementia?
There are warning signs that can suggest that someone's at a higher risk for having disease and warrant a evaluation. But everybody has walked into a room and said, what did I walk in that room for? You have to think about it for a few minutes and it comes back to you. That's age, right? As we get older, our processing speed slows down. It just takes us longer to think about these things. It takes us longer to remember what we had for breakfast. It takes us longer to remember that person's name as they're walking toward us. It takes us longer to do math, right? But we're still able to do it. When we can't remember the person's name, or we don't recognize the person, when we can't balance our checkbook anymore, when we can't find objects and don't know where we put them, that may be a warning sign that warrants some evaluation. From the research side of things, we know that the changes in the brain may begin about 2 decades, about 20 years before people have clinical symptoms. So from a research, that's a very important area because it gives us the possibility of designing prevention studies. But clinically, we can't see that. People are performing normally. They don't have complaints. Or they may have some subjective complaints, like they feel like they're not as sharp as they once were. But usually what we see is the early signs of symptoms are things like people start repeating themselves, asking the same question over again, misplacing things and can't find them, having word finding difficulty, having changes in their mood, having changes in their ability to solve problems, make decisions, having changes in their personality or behavior, having changes in their walking or their motor abilities. So these could be like the early warning signs that something is changing. Now, it could be a disease like Alzheimer's disease, but it could also be something that's reversible. So that's why getting an early evaluation is just so important.
Do you see gender differences that women or men are more likely to develop a certain type of dementia?
Overall, women are at a slightly higher risk than men for these diseases. In particular, diseases like Alzheimer's disease or frontal temporal degeneration, women are at a higher risk than men. In Parkinson's disease and Lewy body dementia, another type of dementia, men are more likely to develop than women. And for vascular dementia, stroke-related dementias, it's about equally distributed.
Your work here, how important is it to determining exactly what a person has, how to diagnose them, and what research are you looking at?
Our projects largely focus on what is healthy brain aging and what constitutes the earliest signs of change. Before I mentioned that at age 85, roughly 4 out of 10 people will develop Alzheimer's disease or a related disorder. But that means that 6 out of 10 don't. What could we learn from those people who don't develop dementia that can be used to develop interventions that either will be treatments or, more importantly, prevention? So it's really important. Our research really focuses on trying to understand how different people and different things they've done over the course of their life might put them at differential risk.
That's a great way to look at it, prevention. We have to treat it, but if there's anything we could do to prevent it, that's so important.
Absolutely. If someone's living with disease, we want to treat them. We want to improve their quality of life and make a difference. But I think where we could really make an impact is instead of waiting for disease to develop, why don't we prevent disease from ever starting? And if we could find that, we could make a huge difference in people's lives.
And once it has started, is there any way to slow down the stages, or is everyone different with this?
Well, everybody's different. So if you've seen one person with Alzheimer's disease, you've seen one person, because everybody's different. How they experience the disease, how they live with the disease is going to be different than another person. And how that family experiences the disease is going to be different than another family. That said, we have treatments today that, one, can help slow down some of the symptoms. Those medicines have been around since the 1990s. And more recently, we have medicines that attack the amyloid, the abnormal protein that deposits in the brain of people with Alzheimer's disease, and can help remove it. Those medicines appear to be modifying the disease in some way, so that people progress much, much slower on those medicines than if they're not on those medicines. Now, the medicines do have side effects that we have to monitor, but we have many more effective ways of treating patients, both their symptoms and potentially modifying their disease.
The caregivers at home also have a big responsibility and a large weight on their shoulders. If you were to give advice about what you should not say or how you should not act to a person with dementia, especially in the early stages when they kind of know there's something wrong and maybe they're just repeating their stories, what would your advice be?
It's always difficult and it's always a challenge because we look at the person that we've known our whole life, and that's the person that we expect. What we need to do is sort of change our expectations and now accept the person for who they are in the moment. So if someone forgets things, reminding them that they forget things is, one, going to make them upset, and two, is not going to change the situation, right? While you want to maintain a person's ability to be as independent as possible, what you want to try to do is reset the expectations constantly based on what a person's able to do and what they're not able to do. So we want to empower people, but we don't want to make people feel bad about themselves. And I think that's one of the real challenges is, we used to be able to do this, but now you can't do that anymore. That's fine, but now let's find out what you can do. Let's not point out what you can't do. Let's find what you can do, and that becomes our new bar. And if we can do that, I think we can make a huge difference in sort of that, dyadic relationship, the relationship between the patient and the caregiver.
What makes you optimistic as far as the future of treating dementia?
I think what we're going to make the biggest impact is if we can develop prevention. And prevention strategies are really going to be a combination of two things. One, lifestyle. So can we find things that either put us at a higher risk, that make us more vulnerable, or put us at a lower risk, make us more resilient? And we know a lot about those factors, and those things are under our control. So we can do something ourselves. So we can stay mentally active, physically active, eat a healthy diet, stay socially active, be mindful, right? Do lifelong learning, right? We can control our medical conditions. We can take care of our diabetes, our high blood pressure. We can take health promotion and positive aspects, right? So those are things that are under our control. And then we're constantly developing and testing new medications. So I think it's really going to be a multimodal approach. Part on us as the patient to take care of our own brain health, and partly using medicines to try to remove the problems that we can't control. So I think it's going to be a multi-layered approach, and I think that's going to make the biggest thing, and I'm very excited about that.
Is there a myth that a lot of people come in here believing, or something that you would just really like to clear up once and for all about dementia?
Well, I would say the biggest overall myth is that memory loss is part of the aging process. As we age, we do not become forgetful. What we do become is much slower in processing information, right? It takes us just longer to remember that thing, but it comes back to us, right? Now, it may come back to us later, but it comes back to us on its own. If someone is truly forgetful, then something is causing that, and we need to find out the reason for that, because some things are degenerative, Alzheimer's disease, but some things potentially are reversible. So even though those things are uncommon, if we find just one person with that reversible condition, we could change their life entirely by treating that reversible condition.
Are there other diseases that mimic some of the symptoms that people might associate with Alzheimer's or dementia?
There are many diseases that can cause an impairment, and so Alzheimer's is the most common cause. But there are other things that can look like that sometimes in the beginning. So for example, People who have depression can look like they have dementia, but they have depression, and the depression needs to be treated, and it can make a huge difference in a person's life. People could start new medications and have adverse effects on those medications, including over-the-counter medications, which people often don't list in their medications. Sleep aids, many of them contain a Benadryl-like medication. It does help you fall asleep, but in older adults, it can also cause confusion. Cough syrups that contain dextromethorphan, so any cough syrup that says DM on it, dextromethorphan does suppress your cough, but in older adults can cause confusion, right? So sometimes even over-the-counter medicines can trigger problems. Infections can cause this. So it's always important, if there's a problem, to get an early evaluation. Starting with your primary care doctor, they know you the best, right? And they can review your medical history. And if there's not something obvious related to that, then make a referral to a specialist like a neurologist.
One final question I have for you. If someone is diagnosed with dementia, they get the bad news, or their family member gets the bad news, what would you want families to know about hope and support and medical breakthroughs and treatments that are available today?
There are many things that are happening in the world related to Alzheimer's and related disorders. So while getting a diagnosis, no one wants to get a diagnosis. While getting the diagnosis itself is not a good experience. What we want to focus then on is, what could we do to improve the quality of your life and provide support for you and for your family? So there are medications, there are support groups, there are lifestyle changes that could be made. So all those things that I said prevent disease, diet, exercise, cognitive activities, there's ample evidence that people who have disease who do those things are going to progress slower than people who don't do any of those things. So what we want to focus on is, we have to deliver the diagnosis. But then after that, we don't talk about brain disease. What we talk about is brain health. So when you walk in our doors, it says Comprehensive Center for Brain Health, because we want to focus on making you the best you that you can be.
Our future episodes will include information specific to dementia recognition, breakthrough treatments, and valuable resources for the patient and the caregiver. We'll also delve into dementia prevention. Also, be sure to visit our website, palmbeachcivic.org, where this series is being posted as it's released. We'll see you next time.